Okay, hello everyone. My name is Stephen Lott. I'm the Senior Lead of Communications for the McMaster Health Forum, and I'm part of the Secretariat for the Evidence Commission. Welcome to Day 2 of Engaging Evidence 2021, and thanks to Cochrane Australia, JBI, GRADE, and GIN who are jointly hosting this conference. I'm pleased to open today's session, Systematizing Best Evidence Use in Routine Times and to Address Future Global Crises. This session draws learnings from the Global Commission on Evidence to address societal challenges. Please use the chat to ask questions or share comments during the presentations. We are recording today's session and will be making it available on the Evidence Commission site for those not able to join. Lastly, if you have any feedback after today's event, please email us at evidencecommission@mcmaster.ca. I'd now like to turn the session over to our host, Jen Thornhill Verma, the Executive Lead of the Evidence Commission Secretariat. Jen?
Thanks so much, Steve, and thanks everybody for joining. I'm hosting today from the traditional territory of the Algonquin people here in Ottawa, which is Canada's capital. It straddles the border between what is now Quebec and Ontario. As I introduce our speakers, I'll ask them to offer a word about their hopes for the work that we're embarking on with the Global Commission on Evidence to Address Societal Challenges. I'm going to introduce them in their order of appearance, and as I'll actually pop up our session objectives here as well, so you can have a look at those. As I'm introducing, I'd welcome you to do the same. Introduce yourself, tell us where you're joining from, if you have any questions for today's panelists or for us at the Evidence Commission. We will try to take your questions as they come in today. So first up, we have Andrew Leigh, one of our commissioners of the Global Commission on Evidence to Address Societal Challenges. He's the Shadow Assistant Minister for Treasury and Charities and federal member for Fenner in Australia. Before being elected to government a decade ago, Andrew was a professor of economics at the Australian National University. He's a fellow of the Australian Academy of Social Sciences, a past recipient of the Young Economist Award. He's a podcast host, a book author, and seems to be pumping out a book a year, it looks like, Andrew, including one just this week called What's the Worst That Could Happen? Existential Risk and Extreme Politics. So Andrew, thanks for being here. Tell us, what are your hopes for our agenda with the Evidence Commission?
Jen, thanks very much for having me along. I too am joining you from traditional lands, in my case, the lands of the Ngunnawal people here in Canberra, so I acknowledge elders past and present. I really want this commission to give us a little bit more modesty about what we know and don't know. Too often, I think policymakers imagine that there is one single answer out there that's known. I'd like to see a little bit more modesty and experimentation as we search for the right answers. And then raising the bar on what constitutes good evidence. It's been a real privilege with me to work with such a diverse and interesting team, and looking forward to talking about some of the report's findings.
Fantastic. Thank you so much. Next up, we have Julian Elliott, another commissioner with the Evidence Commission, and is truly the world's leading clinician researcher in the use of technology for evidence synthesis. He chairs the Australian Living Evidence Consortium based at Cochrane, Australia, within Monash University School of Public Health and Preventative Medicine. And until recently, I understand, was the executive director of the Australian National COVID-19 Clinical Evidence Task Force. Julian developed the Living Evidence Model, which of course we'll talk about today, and is now adopted worldwide, including by the World Health Organization and several guideline groups. He also is the co-founder and CEO of Covidence, a nonprofit technology platform that provides the most widely used software platform for systematic review globally. He too is decorated for his work, the 2017 recipient of the Australian Health Minister's Award for Excellence in Health and Medical Research. And when he's not doing all of that, I understand you're still an infectious diseases physician at the Alfred Hospital in Melbourne. So Julian, thank you too for being here and for being a commissioner. What are your hopes for our agenda with the Evidence Commission?
Thanks, Jen. Again, thank you very much for inviting me to come and join the discussions today and for being part of the commission. I also am on traditional lands here in Melbourne of the Wurundjeri people of the Kulin Nation, so I pay my respects to elders past, present and emerging. I think I've talked about this time as a bit of a window of disruption. As the saying goes, in every crisis there's an opportunity, and I think through the pandemic we've seen a very broad understanding in the general community and policymakers about the role that science can play in the way that society functions. So I think we do truly have a window of opportunity, and I think the Commission can make a major contribution towards grasping that opportunity and looking at what has worked well during this period of stress testing that we've seen during the pandemic. But of course also, where the weaknesses are in our systems and moving quickly to address those.
Fantastic. Thank you so much. And finally, we have Davina Ghersi, our discussant today, is Senior Principal Research Scientist at Australia's National Health and Medical Research Council, where she provides practical advice and methodological support to those engaged in the creation, evaluation, synthesis, translation of research evidence, including systematic reviews, clinical trials, clinical practice, and public health guidelines. She's an adjunct professor at Sydney Medical School. I understand spent time at the WHO as well. Davina, thank you for being here today and starting to wrap your head around our effort with the Global Commission on Evidence to Address Societal Challenges. Based on what you've learned so far, what would you like to see come from this effort?
Thank you, Jen. Like Andrew, I'm on Ngunnawal country, and I'd like to acknowledge the traditional custodians. I've not had long to look at what has been quite an impressive body of work. I agree with Julian that the timing, I think, is right. There's been so much happening, and especially in Australia during COVID, with the way governments have embraced evidence and science to some extent, and that it's an opportunity to leverage. And I'm hoping that this commission might be a framework to support researchers and decision makers in how to do that and provide an ambitious vision.
Thank you. We appreciate that. And we'll look forward to garnering more of your advice throughout today's call. So you see our objectives. I'm going to start with, I promise this isn't an eye test. It's actually going to be a useful slide for future. And it's to reference that each of the slides that follow does have an exhibit number. So as you're viewing today's session, if there's one that piques your interest, you can easily jot down the number. You can head to our website at evidencecommission.org. It's hosted on the McMaster Health Forum's family of websites. And there you can actually get a copy of the PowerPoint deck that you're seeing today, as well as a PDF version that is an extended version of these exhibits. This also just gives you a quick navigation tool of what to expect when it comes to the Evidence Commission's forthcoming report. So I'll dive in. I wanted to start by sharing who we are. And I'm skipping over the details of the Secretariat, but I will recognize our scientific co-leads who couldn't be here today, John Leibus, Jeremy Grimshaw, who, if you ask me questions that I'm not going to be able to answer, I guarantee I'm going to send them a quick WhatsApp to do my best to answer it. But otherwise, we're so happy to bring together a group of commissioners, and I'll actually just show you who they are in this next slide. But they bring diverse points of view to creating a report that really speaks to many different types of people who make or can influence decisions about whether and how evidence is used to address societal challenges. And we think that they reflect the diversity of our audience. So, those who produce evidence, those who are intermediaries, and those who are decision makers, be they citizens, government policymakers, professionals, and organizational leaders. They also cover all of the sustainable development goals. And one of our goals is to inoculate people to the idea that as much as this effort is learning from COVID-19, we believe that this work holds great relevance for a broad many societal challenges. I should also mention that they also bring a great deal of experience to the different types of evidence that we talk about with the Evidence Commission. Our work of the Global Commission on Evidence to Address Societal Challenges, it builds on existing commissions in several ways. And I'll just highlight three in particular, because we spend a great deal of time talking about societal challenges, decision-making, and evidence. And so, of course, you all will be aware that in May, the Independent Panel on Pandemic Preparedness and Response tabled its report. And that commission report, like many, focus on a single category of challenges. In our case, we're trying to prepare for different types of societal challenges, so taking a holistic perspective in that regard. In the same way, many commission reports focus on a single category of decision makers. So the example we've used here, and we will build upon their work, is the commission that occurred under the Obama administration in the United States, the Commission on Evidence-Based Policymaking that particularly looked at the use of evidence in government and federal government in particular. Here, we're looking at a broad range of decision makers, and I'll talk about those specifically, but citizens, for example, have been instrumental in the COVID-19 response as much as government policymakers and business leaders and others. And then finally, evidence. There was a report that was tabled also back in May, June. The G7 Science Academies released a report looking at data to prepare for future health emergencies. And data arguably has gotten a lot of play during the pandemic, potentially at the expense of other forms of evidence, which are quite useful in decision making. And so here, when we say evidence, we really mean research evidence. And you'll see in the upcoming slides that we're taking a holistic perspective, thinking about challenges, decisions, decision making, and evidence. I want to mention briefly our connection to the COVID-19 network to support decision making, and it's a partnership of a number of partners that work in the evidence production area, be it from synthesis, technology assessment, guidelines, and so forth. And in the same way that this group came together to support evidence creation and dissemination during the pandemic, it was also this group that said, you know, in the same way, couldn't we use a similar machinery for other societal challenges ahead, be it in routine times or to address future global crises? And this just gives you a quick view of the number of partners that currently inform the COVID-19 evidence network to support decision makers. I want to dive in and just give you a quick overview of challenges, evidence, and decisions, and I'm going to come right back to Andrew to get things going. In some ways, when we think about societal challenges, it defies any kind of simple categorization. And so you see, we haven't landed a simple categorization, but I'll just show you that quick view of the top row to give you a sense of what we mean by societal challenges. And so some challenges are conducive to taking a country level sectoral response, health systems failing to improve health outcomes and care experiences being a good example. Others require a within country context cross-sectoral action. If you think about something like antimicrobial resistance or addressing lack of trust in institutions. And still others require a global level response, as we've seen with COVID-19. And mostly our goal with this particular exhibit or visual is to, as I said earlier, inoculate people to the idea that this is about more than the pandemic. We're going to learn a lot from the stress testing that Julian described that's happened during the course of the pandemic in terms of curating best evidence for decision making. But we think that these lessons hold greater value and potential when we think broadly about the challenges ahead. Decision makers, I'd mentioned, this is the full roster of who we believe informs the response to societal challenges like the COVID-19 pandemic and others ahead. And then I want to just spend a little bit of time on what we mean by research evidence. And we know that people certainly make decisions for reasons not captured here. And I think the most obvious example is making a decision based on one's own lived experience. And that's crucially important. But what we really wanted to focus on are the types of evidence that are particularly conducive to supporting decision making. And so I think many of the folks who are coming here from engaging evidence will come from guidelines, synthesis, for example, potentially technology assessment. And, you know, with the commission, we're really looking at a range of research evidence and recognizing that some forms of evidence will be more instrumental in addressing some decision-making questions and context, like data analytics helping to really elucidate the magnitude of a problem, whereas qualitative studies may be able to shine a light on stakeholders' views and experiences. So very quick overview of the commission. I'll just pause for a moment. And Steve, I wonder, I can't see the chat. So do you mind if there's a question that comes in, feel free to interrupt and let me know. But
sure, no problem, Jen.
Yeah.
There's no questions at this point,
Okay.
But I'll let you know.
Okay, perfect, great. Okay, so Andrew, I'm gonna come to you now, but I just want to set up this particular slide for folks that in the context of the commission, we talk about best evidence as synthesizing all that is known really about a particular question. And sometimes in the decision-making context, you don't have the luxury of having best evidence. So we talk about those other things that might run by your desk or be put in front of you to offer you some level of evidence. And frankly, some of it is not going to be particularly helpful, but you have to make decisions anyway. When we produce this particular exhibit, and I should say it's an abbreviated version of the more lengthy exhibit, which is on our website, it seemed to particularly resonate with you. Why?
Jen, it reflected to me the notion that very often the alternative to high quality evidence isn't low quality evidence. It's listening to the highest paid person's opinion, the hippo effect, or the good old boys sitting around a table, gobstat. And the risk of that is that you will get decisions that are driven too strongly by people's priors and not enough by a good evaluation of what's around. This isn't because the actors are necessarily motivated by ill intentions. It's simply that understanding evidence is hard, and people aren't necessarily trained to know that there is a hierarchy of evidence, that in many cases, if you're looking at medical questions, randomised trials will be much more useful than observational studies, as hydroxychloroquine has shown us very clearly. And also that there are such things as evidence syntheses, which draw together the whole body of evidence. Humans are storytelling creatures, and I think we quite like single studies because there's a story in the single studies, but that can be a little bit alluring and lead us away from taking the bird's eye view and really bringing together all of the evidence by looking at an evidence synthesis. And what Cochrane and Campbell have done across a whole host of fields is to produce great evidence syntheses. And my main task often with colleagues is just to say, don't read anything until you've read the best evidence synthesis in the field.
I'm curious to know, Andrew, because you spent time in the academic world and of course now a decade as an elected official. I'm curious if you find yourself in a translational role or helping to provide some advice or on what constitutes best evidence. Do you find yourself in that position at all?
Absolutely. Politics is the world of power. Academia is the world of ideas. And I do my best to act as a transmission belt between the two, going along to academic conferences where I can to be available, taking academic studies from former colleagues and putting them in touch with parliamentarians. And my parliamentary colleagues are enthusiastic about doing that, and not just on my side of the parliament. There is an admiration for people who have devoted their lives to studying questions carefully and a desire to get things right. But there's not necessarily the training to understand how best to use evidence. You look, for example, at the case of bed nets in Africa. For a long time, there was a view that co-payments were important, that people wouldn't put bed nets over themselves and their kids unless they paid something for them. And the alternative view was if you gave them free, then you get higher distribution rates. But it took a handful of randomised trials drawn together in a careful synthesis to show that free distribution of bed nets was actually much more effective in saving lives from malaria. And that's resulted in free bed nets being rolled out across Africa. My favourite example of a randomised policy trial saving thousands of lives.
What would you say, and bearing in mind that I think the large majority of our audience are coming from a researcher perspective, what really, in your view, has helped to increase the chances that best evidence is considered and used?
COVID has been important. We've seen deference to experts among governments of most political stripes, and that's been, I think, a healthy thing. And there's been some positive spillover of that into climate, where the tradition of recognising the wisdom of experts hasn't been as strong. So I think that's encouraging, but we've still got a long way to go. Governments as evidence creators is something that I really admire about the way in which we're shaping up our report. Not simply saying that all the answers are out there. Governments simply have to look harder. But saying that if government is rolling out a new program, sometimes we really won't know whether or not it works. And so that's why it's important to take a leaf out of the book of the Mexican government when they rolled out conditional cash transfers through Progressa. And they simply, rather than rolling it out in an ad hoc manner across villages, they randomly broke the villages into two groups. One got in the first year, one got it in the second year, and then they had an experiment that showed them rigorously in the first year the impact of conditional cash transfers. And that program is now not only solid in Mexico, but rolled out in nearly 30 developing countries around the world. So I'd love it if more advanced countries were taking a leaf from the Mexican government's book and doing randomised trials themselves.
Jen, I'm just...
Oh, yeah, sure, go ahead.
Sorry, I'm just going to jump in because there's a couple of questions in chat here.
Perfect.
So they're related to this, this slide here. So Faraz asks, where does tacit knowledge fall in that diagram? And then Ellie has a bit of a commentary and question, says the hierarchy of evidence has been challenged a bit during COVID-19, so that a supposedly well-designed, high-powered RCT may not provide the evidence needed for a decision, for example, mask wearing in the general community. So what do you do then? And similarly, a lot of complex interventions in public health can't be tested through RCTs. In fact, the best evidence we usually have comes from well-done natural experiments, e.g. interrupted time series analyses. The evidence hierarchy doesn't really engage with this at all.
I don't know if any of our panelists want to respond to that last point. I'll just say on the tacit knowledge, I did want to make clear that when it comes to how we conceive of evidence, we've really focused on research evidence that's useful in decision making, but not to the exclusion of recognizing how people make decisions, often based on their own lived experience. And so you do see throughout the Global Commission on Evidence to Address Societal Challenges discussion around how citizens interact and use evidence, for example, or how any of us do that, all the different types of decision makers that we factor in. But we've tried to, in this particular chapter, prioritize looking at use of research evidence and where it's particularly instrumental to address common decision-making questions, be it related to understanding the magnitude of a problem, deciphering options, monitoring the effect of having selected a particular approach, and so forth. So you do see it throughout the report, but in a certainly nuanced way. Otherwise, any responses to the commentary we had, I think from Elliott was?
Okay, you go, Davina.
I think the hierarchy of evidence has evolved since it first came into being, and acknowledgement, particularly with frameworks like GRADE and sort of evidence to decision type frameworks, that the evidence is one element. What you need to do is apply judgment to a body of evidence and the best evidence for the question that you're asking. So I'm not sure that referring to the hierarchy of evidence has the same meaning as it did 10 years ago when it was first sort of came into being.
And my reflections is through the pandemic, we've obviously had an incredible amount of research, and that's contributed, of course, to the responses that we've had so far. But I think it is certainly true that there has been a skew towards drug research. And if you look at the total amount of funding and the availability of high quality evidence in non-drug interventions, so for example, mask wearing, it really has been underdone. In the National COVID-19 Clinical Evidence Task Force, we were asked to look at healthcare worker PPE, so including masks and eye protection. And this was about a year into the pandemic, and of course, did all the usual rigorous processes to identify evidence. And really, it was an absolute travesty, the lack of high quality evidence that we had at that time. It is, of course, in many of these situations, as I think Ellen noted, extremely complex and difficult to accrue high quality evidence in some of these public health questions, but it's certainly not impossible. And I think I just link this to another reflection, which is that, when we have really strong partnerships and systems in place before a crisis, then we can really utilize that and generate very high quality evidence. So I think one great example are platform trials, which have been used for clinical interventions, which are, an existing infrastructure which is persistent over time, and particular interventions can be inserted into that infrastructure in a very dynamic and quick way. So I think through the pandemic, we've really seen how that platform trial infrastructure established pre-pandemic really came to the fore. And I think similarly for public health interventions, I think this really is one of the key learnings, that we can do more to establish an infrastructure which can then generate high quality evidence during that period of crisis, whatever the next crisis might be. And let's predict it's probably not going to be a pandemic, it may be some other global health crisis. So just noting, Paul Glasziou and others are leading a group called BESI, which is really, I think, doing great work in highlighting the incredible importance of non-drug interventional questions in addressing global health challenges. And I think we really do need to pay more attention to that.
Thank you so much, Julian and Davina. And Andrew, I know we're going to lose you any moment, so I want to try to just get in one last question with you, given that you just released your book, and in it you talk about a certain type of extreme politics that really fails to be motivated by long-term planning and strategizing, and very likely sees research evidence as elitist. And I wonder, can you give us some insights from that book that's relevant to today's discussion?
Thanks, Jen. What's the Worst That Can Happen focuses on things that could end the world. A catastrophic pandemic, nuclear war, artificial intelligence gone wrong, and the like. And one of the things it focuses on is the way in which those problems are all worsened by the rise of populist politicians. Populists are anti-intellectual, they're anti-institutional, they're anti-international, and they try and engender a sense of outrage and anger rather than calm and focus. These aren't bugs, they're features of populism. They are inherent to the way in which populists operate. But all of those things make it harder for us to deal with long-term challenges that require looking to science for answers, approaching questions calmly with reason, working together as countries, and using strong institutions to tackle these challenges. And so in the case of evidence, I think it's not surprising that it's been populists that have touted unproven cures to COVID, that have doubted the science on climate change, because that's one way in which populists have sought to build a base of support. So tackling populist politics, and that's populism on both sides of the political spectrum, is going to be important as we look to better use evidence and build a world which is more based on strong science, strong institutions, calm, reason, and international cooperation. Jen, I'll stay on the conversation for as long as I can, but okay. If I have to drop off, thank you to you and all the participants for being in touch. If people want to contact me directly, Aussies should always feel free to do that.
Fantastic. Thank you so much. I'm going to transition slides here, and Julian, I'm going to pick up the conversation actually where we just left it off. And I want to tell you that Paul Glasziou just gave you a shout out on Twitter for referencing the imbalance between COVID-19 research on drugs compared to non-drug interventions, as documented on the scorecard at besi-collab.net. And so I wanted to share,
Sorry, can I just interrupt? If I can railroad for just one moment.
Sure.
Andrew, I think what you're talking about is so important and so true. Do you mind, Jen, if I just ask Andrew?
Go for it. And so listeners know, we said we wanted this to be informal. So I'm going to stop share just for a minute so you guys can see each other.
How do you think we do that? How we of course are seeing the rise of populism across the world. So, I would wholeheartedly agree with you that this is a very significant and profound challenge to the way that science can be used in our society. So, how do we address that?
So, Julian, my theory of the rise of populism is it's to do with jobs, snobs, race, pace, and luck. We can't do much about the fact that the populists have had luck on their side. That Trump is a better campaigner than some of the populists that preceded him. But we can do more to create jobs, to make sure that there is a strong middle class in advanced countries, and that those formerly manufacturing voters don't turn to populists. We can make sure that we're not snobbish in our education system, that there's an education system that delivers for the most vulnerable, rather than ploughing all of its resources into kids of the most affluent, as some systems risk doing. We need to be sensitive around debates over race. The Virginia governor's race, in some sense, came down to a populist weaponising the teaching of critical race theory, and progressives need to get better in how we talk about race in a way that engages a broad swath of the community. And pace is a recognition that many people turn to populists from that sense that the world is moving too fast and I want to get off. Populists offer a return to a halcyon day, which of course they can't deliver. But talking more about traditions, national identity, about the stability of the world, I think is an important part of the communication challenge for people like me. I don't have all the answers, but for me, it's the number one question, because I think unless we get the politics right, then a lot of the policy founders.
Wonderful. Sorry, Jen. They were just
No.
I really had to pursue that. I think that is
Absolutely, and I
resonates very
respect
strongly.
it. Yes, I felt so too, and I've started reading the book, Andrew. So I'm gonna toggle back to the conversation and just mention that we were talking about evidence synthesis as really this optimal form of evidence, but we dug into, as part of the Global Commission on Evidence to Address Societal Challenges, the coverage and quality and recency of syntheses as it related to the Sustainable Development Goals, and also as it related to COVID-19. And you can read about the full methodology and approach that was taken in the PDF version of this particular exhibit. But we really analyzed two what we call one-stop shops for evidence syntheses, one that focused on the non-health Sustainable Development Goals, and then also another that looked at COVID-19. So it was the Social Systems Evidence Database, and then the COVID End Inventory, and the larger database from which it's drawn. And so you can see the results here on the SDGs, that coverage was uneven, quality was uneven. All the SDGs had a median year of last search that's 5 or 6 years ago. Only between 1 in 10 and 1 in 20 evidence syntheses about most SDGs included at least one study from a low and middle income country. And then similarly, on the COVID-19, coverage was uneven, quality was uneven. 3 of the 4 COVID-19 response categories have a median date of last search that's within 4.5 months. And so, Julian, this is a big question. I'm not asking you to take responsibility for it, but can you just help to relay what do you think is going on there, and how do we remedy those coverage and quality and recency issues?
No, thanks, Jen. I'll make a couple of comments then. I'm very interested in Davina. I'm sure also has additional thoughts, and perhaps Andrew as well. I think we have to think of where evidence started and where it's been strongest, and I think also recognise the fact that some of the evidence systems within health have really been established essentially around the regulation and funding of drugs. And so that system that was established, in order to protect human health in a very direct way has really had some tailwinds behind it that has enabled us to become very well established. But of course, we're well beyond that now. This approach that we call evidence has been going on for some time. And I think the fact that we don't see as greater strength in some of these non-health areas, is something that many people have been trying to tackle for a very long time, but we're still very far behind, as these figures show. I'm quite interested in the role that UN agencies beyond WHO might play in trying to shift this, particularly in this kind of window coming out of the pandemic. And Davina's worked within the UN system. I'm sure you have some thoughts on this, but I think it is, although we know there are challenges in the way that evidence and guidance has kind of evolved within WHO, it does, I think, have a strong culture and practice around evidence and using evidence in the best possible way in its kind of normative statements and documents. And that culture is not as strong in other UN agencies, and perhaps there's an opportunity coming out of the pandemic to be making some very clear statements regarding that as a way of trying to perhaps catalyse a greater shift in the use of evidence in those other areas.
Davina or Andrew, if you care to weigh in. Also okay if you don't.
I think it's to some degree a matter of a practice of questioning what you do and making sure you ask the right questions. And in health, I think, especially since Cochrane and systematic reviews in the early 90s started to become more popular and common, that focus on asking the right question and asking an answerable question has evolved. And I don't know that in other areas, that ability to question and maybe challenge thinking and then look for the evidence to support your thinking in a systematic way is perhaps there. I mean, Campbell has made a staff. I'm not sure how entrenched some of the Campbell network is in Australia, for example. I was going to come to this later on, but I'm thinking of how relationships are formed between decision makers and policy makers and the people who understand and synthesize the evidence. So we can come back to that later, but the potential is there.
Mm-hmm. I'm going to toggle ahead, but Andrew, if you do want to come in, feel free to go for it.
I'm happy to let it roll. Thanks, Jen.
I wanted to, of course, I had to talk to Julian about living evidence products, and four of the forms in which evidence is typically encountered by decision makers, as we were describing 8 forms earlier. So 4 of them are now available as living evidence products, regularly updated as new data is added. And many examples of these arose as part of the COVID-19 evidence response. And so, I'm curious to know if there's become a bit of an expectation in your experience on those who rely on these sources of evidence of that level of updating. And also curious what you see as the role of living evidence products in addressing the global challenges ahead.
Yeah, thanks, Jen. I think that's a great question, actually. So I think at this point, of course, the whole approach of living systematic reviews and living guidelines has got some considerable momentum during the pandemic. And we've seen that now being adopted by WHO, by NICE in the UK and many other groups, including groups here in Australia. I think that we have to be cognizant of the potential dangers or unintended consequences. So I think, first of all, like any kind of initiative like this, it can start to become a bit of a buzzword that is perhaps misunderstood. And one of the things we're trying to emphasize at the moment is that, living guidelines are not living opinion, that the absolute foundation for any form of living guideline is grade methodology. And so I think, really trying to reinforce that point every single time we're talking about living evidence in the context of evidence and guidelines, I think is critically important, because I imagine many groups who are not yet doing grade will try to jump onto this as the kind of the new thing, sort of bypassing their adoption of grade methodology, and that's clearly a mistake. So making that transition to grade, I think, is the foundation. I think also, again, we've been very clear that living approach is not necessarily appropriate for all questions. And so in a particular circumstance, it really is about what is the need of stakeholders, of end users. And so in the context of the COVID pandemic and clinical guidelines, there was a very, very clear need for clinicians to have forms of guidance and evidence that they could turn to that were both trustworthy and up to date. And up to date, of course, in this context was kind of, more frequently updated than we'd ever done before. So updating every week. But of course, in other contexts, for other types of questions for stakeholders, there may not be the same definition of currency, and there may be other needs that are just as important. I think just to note, and again, I think Andrew would be aware of this. I wrote a great article recently about in economic policy making now the increasing role of real-time data in informing economic policy making, whereas previous, you'd wait for the marketing manager's report or the payroll report or whatever it is that would come out every quarter or so. There's economic policymakers now have much greater access to real-time data feeds, and I think again in health we're going to see a rise of similar sort of processes. So whether that's data coming directly from health systems in a kind of learning health system type model, but together with this more dynamic approach to synthesizing evidence and producing guidelines.
I was just going to say, building on that, there's been a growing recognition in economics that our forecasts are pretty terrible, and that in fact we were better to do what's called nowcasting, to do a good job of working out what just happened rather than to try and gaze into a crystal ball. But it's striking too that even with the big data revolution, there's still a need for estimating causal effects. Google is doing dozens of randomized trials at any given time, despite the fact that it's sitting on more data than anyone else on the planet. So having lots of data isn't a substitute, as Julian and Davina well know, for putting in place a credible comparison group.
Jen, can I just riff off that? Or I don't know if Davina wants to add. Yeah, just to say, I mentioned platform trials earlier, but again, I think it's just thinking through, and this is, I think there's an analogy here in our evidence systems, it's thinking through really persistent, broadly applicable infrastructure that we can really build now in preparation for future crises, that make the generation and use of high quality information much easier, much more dynamic, much cheaper. So I think platform trials are a really interesting kind of model for how we can do that in the generation of randomized data in primary research. And I think there's a lot that we can do in evidence systems to push efficiency, push down the unit costs, so that we can be, doing those high quality syntheses, but doing it in a way that is we can scale over a much greater set of questions and keep it up to date with research. So that I think, Andrew, you made a point earlier about some of this is it's hard to grapple with, for people who are not in the work of evidence. It's not necessarily very approachable, and we need to continue to work on making that evidence as easy to engage with as possible.
I just wanted to share this particular exhibit slide briefly, just to say it might be one that will pique our listeners' interest. And again, these and many more, there's about 52 exhibits currently developed, and most of those are available on the evidencecommission.org website. But this one particularly delves into what would a national infrastructure look like. And so evidence is something that decision makers can use, while research is something that researchers do. And this particular exhibit, it really looks at the evidence that's emerging from the research as being ready for prime time, can then be drawn into the evidence support and evidence implementation system. And so I'd encourage you to look at the more in-depth version of this particular exhibit. And I did want to ask Julian, yourself, and Davina as well, what infrastructure do you think needs to exist to really support evidence synthesis? And draw from you have, of course, country context, but global experience as well. So I'd be curious to know what you think is needed.
Davina, perhaps do you want to go first?
I'm not sure that it's necessarily infrastructure that needs to come first. It's about culture and I guess attitudes towards evidence, and a desire to ask the right questions and then look for the right evidence to answer, well, not the right evidence, the best evidence to answer those questions. And changing culture is time consuming and challenging, and it takes time. So I'll leave it there, I think.
Davina, I can ask you a follow-up question that you alluded to earlier. Maybe I'll just phrase it differently, because you'd started to say you would talk about this in terms of partnership, and I'll stop share now, actually. What do you think would help increase the chances that the best evidence is used? And, given we do have a predominantly, I think, researcher audience, advice on that front, I think would be particularly helpful. But you earlier alluded to partnership, collaboration, trust.
So when I was looking at some of the documents, it occurred to me it's very idealistic and ambitious and visionary. I like that, but there is a potential danger in setting the bar so high that it's unachievable, and people get a bit anxious and nervous about it and think, well, that's what they think. It's all very academic, but I'm in a real world having to make decisions every day. So how do I do that? And I think I think we forget that public servants and politicians are humans, and they need to trust. They need to trust the people they're working with. They need to trust the evidence they may be basing decisions on. And as Julian knows from the task force, people think, oh, the COVID-19 task force happened overnight. Well, it actually didn't happen overnight. It took many years of persistence and communication and forging relationships with people in government, and in the community, and a lot of relationships, forming partnerships, becoming trusted by the people who make decisions or need to use evidence. And so when the pandemic happened, there was a relationship that could then be leveraged. I mean, Julian will know more about what actually happened, but I can see that over time, it took a lot of time, and politicians and public servants will form relationships with the people that they trust. They may use information, and when they know they can trust that relationship, they will use it again. If they learn, if something goes wrong, they will not trust that relationship. And I was thinking this morning as I was having a shower about what's a good analogy for what this could look like. And it occurred to me, like, let's imagine a theatre production where you've got the actors and actresses on the stage dealing with the media, doing the communicating. You've got the people backstage, maybe the public servants, the head of makeup, the head of costuming. And then you've got the suppliers, the systematic reviewers who might turn up at the back door of the stage. Here's my systematic review that tells you which makeup to use or which costume to use. And if you leave the box of systematic reviews at the back door, they'll still be there a week later. Nobody's going to use them. You can tell them that the people inside backstage that they're there, but why would they access it unless there was some way to walk them through what those systematic reviews are, or they actually understand what they are, keeping in mind the way that people can move so quickly out of positions within government agencies as well. So how do you have forged relationships that can transition effectively over time, so that people hand over? Here's a way of looking at evidence that we have developed and we trust, and I'm going to hand it over to the next person who fills this role because it worked for us and it will work for you too. So I think that those relationships, I think there will be a danger if if the commission's work gets posted online and people think it's about government and decision makers and funders, that they're the ones that are going to have to change their ways. This is actually about researchers, the people who use evidence or who create and synthesize evidence, forging those relationships so they understand what the decision makers need. And that takes time, and it takes a bit of resilience, and it takes effort to forge those relationships and have those conversations. And it also means researchers have to collaborate and form partnerships amongst themselves, because you're not going to get hundreds of researchers going to different people and forging relationships and having conversations. There will be a few people that are trusted. And so the research community needs to work collaboratively so that they can be trusted as a group, the way Cochrane has trust within some sections of government. So they were my initial thoughts when I was looking at this, that it's good to be idealistic, but it doesn't stop at the documents that have been created.
And so I've put on the screen for everyone's awareness, it gives you the general kind of vicinity of where we're working on key recommendations for which audiences and also the areas in which we're headed toward in terms of tabling our recommendations. And of course, this work is still underway. And the reason that those exhibits exist on the Evidence Commission website is because we are seeking your input. Over the next couple of weeks, we're going to continue to take input to enhance the work that's been underway now for the past half a year. But Julian, to Davina's point in regard to the National COVID-19 Clinical Evidence Task Force, I mean, she alluded to the fact that it seems as though that just kind of materialized, but there was a lot of groundwork already in place, if I understand correctly. And so can you just speak to that a little bit and maybe elaborate on Davina's point there in terms of, that there's a long game here in terms of relationship building?
Yeah, thanks, Jen. No, Davina, I love the way you frame that. I think that is just perfect. Yeah, of course, we were able to establish the task force very quickly because of all the work that we've been doing, not only in the model and the we had literally the people with experience, but also the relationships that we had with the National Health and Medical Research Council and other parts of government. I think I just want to highlight a few of the words that Davina just kept repeating, which was trust, partnerships, relationships. Like, again, I think they're absolutely critical, and I would just describe those as part of the infrastructure that we have for evidence-informed policymaking, and as what we also need to continue to build, particularly in reflecting on what we've learned through the pandemic. Again, I quite been reflecting on, in the kind of the grade model where you think of, what we're trying to do is bring together the best evidence we can together with expertise and preferences and values. And so I think that basic kind of paradigm applies here in the way that we engage with policymakers. Policymakers, I think, will look to experts, as Davina said, but I think what we need to do is ensure that we from the evidence community are bringing that expertise in whatever field it is together with really robust evidence processes that are, and again, of course, I would say, not only using robust methodology, but is also timely, responsive, constantly up to date. So, that if we don't bring those two things together, it's imbalanced, and then we can have a misunderstanding of the role that experts can play. But then also together with, when we think about preferences and values, it's a deep understanding of our stakeholders, of our end users. And so this includes policymakers. Where are they? What do they need? And how can we best respond to that? And then, of course, that kind of connection into the wider community, what the wider community needs.
Jen, just quickly,
Yes.
so this, I think, builds on what Davina and Julian have already
Yes.
talked about, but Bill Thole just mentioned that building receptor capacity is key. And then he asked, how does this get done with the high churn rate among senior health decision makers, politicians, and public servants? So like I said, I think Davina had already touched on that, but a timely question.
Mm-hmm. I want to just give it in the couple of minutes, and then we can continue this conversation, but I want to make sure that folks see that we are continuing this particular dialogue at some upcoming events, some past, and you can see the Cochrane Convene session, for example, as a recording, but the Global Evidence to Policy Summit is coming up next week. We'll have a presence there. There's a number of other events, and you can find all of this by searching our website, signing up for our newsletter. And also there are a number of social channels which we've been engaging with you actually during the course of this session. Thank you for retweeting the work, put the message out there, use these exhibits. We want to be able to create a report that is shareable and useful and is interactive. So the degree to which you can help contribute to that effort, we greatly appreciate it. I wonder, in terms of sort of closing thoughts, I've shared with folks how to continue this conversation. Where would you like to see this effort and work go next? And Julian, I'll start with you. We of course have our work cut out for us this next month in finalizing our recommendations, finalizing the report, and issuing the report. An embargoed copy will be available in December, and then the final copy in English and actually 6 languages beginning in 2022. But what would you like to see in terms of the runway and work that we're doing with the Commission? And Davina, I'll similarly come back to you.
I think for me, it's about, again, trying to grab this moment of opportunity. And I think that the kind of key challenge now and there are many, many conversations going on, I think not only in Commission, but many other fora around, what have we learned? I think really now it is about, engaging communities in those discussions. We are, we've got a commission, and the Commission is, I think, developing some great kind of summaries of some of the ways that we can move forward. But I think now what we need to do is really, really build a conversation. So I think events like this and getting more awareness and more conversations going, and then activities that really engage with kind of stakeholders, people who are of communities that are ultimately affected by the kind of systems that we're talking about here, is kind of the critical next piece.
Davina, your thoughts? And I know you spoke to this earlier, but in terms of where you'd like to see the work go next, and taking your point around, it's ambitious? Is it ideal? Is it overly ideal? How do we bring it down to earth and make sure that it continues good work that seemingly is already started and helps ramp it up and take it to the next level?
Well, there's a question. I think persistence for a start, and I think maybe from a researcher's perspective, having been in both camps, I think understanding the needs of decision makers and communicating with those decision makers more, and I mean that in a two-way dialogue, not just pushing information, but really trying to understand the framework within a decision maker, within which a decision maker is working. So, for example, with NHMRC, we have governance systems in place, we have legislation and regulations that dictate what we can and can't do. So when trying to understand the context within which a decision maker is working, and understanding their needs, and then working with them rather than against them, I think will encourage people to be using evidence more consistently. And I think one of the challenges, I think, is communicating effectively and communicating risk effectively, and the community understanding that evidence changes and risk changes over time. That was demonstrated in Australia, for example, with wearing of masks, vaccination uptake, that as the baseline risk changes, that the evidence and your decision making may change over time. So I think the most challenging aspect, I think, is, I was going to say changing the culture, but evolving the culture so the community understands evidence more and is able to ask questions and use evidence more effectively, and that they understand that information can change and that their decisions may change, and that's normal for that to happen. It's not, and importantly then the media comes into that and how they communicate with the community about evidence and how it may or may not change, rather than going for the headline. But that's another conversation.
It is, and I hope that our listeners will sign up to join us at some of these upcoming events to do just that. I want to thank you. I know we are at time. Thank you for spending your hour with us. You could be in a lot of places. We're grateful that you're here. And also, I want to thank Engaging Evidence 2021 for creating the spot, and of course to our panelists for their insightful ideas and experience. So this adjourns today's panel. Have a great day or great evening, depending where you are, and hope to connect with you all again soon.